John Ogle?
No time at all.
Bull crap.
The doctor will be with you in just a moment.
That's bull crap.
Wasting my time. Oh, hello, doctor.
Hello, how are you all doing today?
How are you?
My name is Dr. Glover. How are you all? I'm doing great. How are you? Yes. Yes. I'm very good. So what brings you boys in today?
Well, doctor walked up to give me a cold pop, and I thought somebody was barbecuing. And then I said, "Oh Lord Jesus, it's a fire." And I didn't grab no shoes or nothing, Jesus. I just ran. And then I fell down the steps. And I started to get some pain in my right leg over here, doctor. And ain't nobody got time for that. No time.
Okay, so what you're telling me is you fell down the stairs
Yes.
and now you have some leg pain.
Yes, ma'am.
Okay. Is your leg swollen?
Well, according to my calculations, it looks like it is on the inside to the left.
Okay. Well, what I can do for you is I'm going to send you home with some ibuprofen.
Yes.
Are you familiar with the name ibuprofen?
Yes, ma'am. I use it. I use it very often for headaches.
Okay, yeah, that's right. Sometimes, you may hear it as Motrin, or women may use it as in Pamprin or Midol.
Yes.
But the classification of this drug is NSAIDs.
Yes.
And sometimes the reason why this drug is prescribed is for rheumatoid arthritis or osteoarthritis, pain, fever, migraines, and sometimes they prescribe it for juvenile arthritis. And I'm going to give this to you in a pill form. I actually have some right here.
Can't take no time for that.
And this is 200 milligrams, and it's a tablet. And you take it by mouth.
No time for that. Thank you, doctor.
You're welcome. But you want to be careful because sometimes you may have some side effects from that medicine. And you may have dizziness, you may experience headache, nervousness, edema, fluid retention, tinnitus, which is ringing in the ears. You may have some abdominal pain, bloating, constipation, decreased appetite, diarrhea, epigastric distress, flatulence, so that means you may have some gas. And
Doctor, don't worry about that. I already have that all the time. And normally it is very rank.
Okay, well, you may experience some heartburn or nausea or vomiting.
That's okay. We used to it.
But I don't think that you will be experiencing a cabbage anytime soon. Do you know what a cabbage is?
No, doctor, no.
It is a coronary artery bypass graft. It's a type of heart surgery. Excuse my dogs; they're just a little annoying.
No, I can see them.
But you should not take the ibuprofen right before the surgery or right after the surgery. But that doesn't really affect you. But I may ask, are you allergic to aspirin?
No.
Okay, well then you're fine, because if you're allergic to aspirin, then sometimes when you take ibuprofen, it may cause you to have a really bad allergic reaction. But with this drug, you don't have to worry about any kind of food warnings. Like you can eat just your regular diet with this drug.
Okay.
I gave that to you in the tablets. So, and do you know how you're going to take that?
Yes.
How are you going to take it?
By mouth.
By mouth. Okay. And I do want to let you know that the full anti-inflammatory effect, it may take up to 1 to 2 weeks to develop. So it may take a little while for it to fully resolve your problems. But we're going to monitor you for GI bleeding because sometimes if you take it for a long period of time, then you may experience some GI bleeding.
Yes.
And
Well,
we all
actually-
know that you don't have time for that.
Yes.
We are.
No time.
No time.
Yeah.
Actually, when I was younger, I had an upper and lower GI.
Oh, yeah?
Yeah, a surge.
Okay, okay.
Ew.
Well, I also want to ask
Sorry.
you, how old are you?
I am 13.
13. Okay, so you should not be drinking any alcohol, right?
No, ma'am, no.
Okay.
Bad.
Okay, well then I won't go
Bad.
into that.
You just.
Sometimes if you experience that GI upset when your stomach starts
They
hurting,
never can.
but I know that you all don't have time for that.
No time. No tea. No
But
time.
Dear Lord
sometimes if you take this ibuprofen with your meals, or if you take it with milk, then it will reduce any adverse effects. Okay? And I know that it's summertime, so you don't want to be out in the sun too much while you take this medicine. And if you are, then you want to use a lot of sunscreen.
But when
Okay?
we, the math club, go out, we have to go out the same. We go bird hunting.
Okay, well you just
Bird
want
box.
to use some sunscreen, okay?
Make sure you get, I can
Should
get
Probably
always
30,
50.
30 or more.
30.
Yep.
We get 45.
Well,
Clark.
I'm typically, most of the time, I have pretty fair skin, so,
But that,
I mean, sometimes I get a tan, but.
Okay, yes.
there's no problem with that.
Well, it just increases your risk for getting a sunburn
Yes.
when you take this and you're out in the sun. But I do want to tell you, I don't know if you're on any of these drugs or not, but if you take
On drugs?
corticosteroids, they may cause adverse GI reactions.
Yes, I'm not on any drugs.
No time for any drugs.
Okay. Well,
Drug free.
sometimes if you're on, are you on digoxin, lithium, or any anticoagulants?
No, ma'am, no.
Okay, well that may increase levels or effects of your drugs that you're taking.
Yes.
Now, I know that you're not taking methotrexate, so
No,
you
no,
don't
no,
have to
no.
worry about that. But it also has an interaction with that. It may decrease the methotrexate clearance and increase the toxicity. So for your pain, I gave you the 200 milligrams,
Yes,
and you're going to take that by mouth every 4 to 6 hours.
yes.
Okay? And you can take that as needed.
Yes.
So if you don't need it, then don't take it.
Yes.
Okay? So I think that's all that I have for you boys. Do you have any questions?
Nope.
We had no time, babe. No time.
Yeah, we ain't got no time for you.
Okay.
Sorry, you just.
Okay, well I hope
very
that
pretty.
you find some time to take your medicine.
I will.
If not, then your leg pain won't go away and your inflammation from where you fell will not go away as well.
Yes.
Okay? Thank you.
Can I have your number?
Do you know you talk a
No.
lot?
I talk loud. Okay.